You're most likely to have a stroke before you even finish your morning coffee. One wrong move in your morning routine could send you straight to the ER. And yet 7 simple habits can flip that risk completely around. I'm Dr. Jonathan Myers. I've spent more than 3 decades treating stroke survivors and helping people like you avoid becoming one. Most people think strokes are random, but they're not. They follow patterns, especially in the morning when your blood pressure spikes, your brain is dehydrated, and your heart is under pressure. In this video, I'll walk you through 7 doctor-approved habits that lower your stroke risk before 9 a.m. starting tomorrow morning. They're simple, they're fast, and they might just save your life. Let's begin. Your morning routine sets the stage for your entire cardiovascular system. Right after waking, your blood pressure surges. Your blood is thicker due to overnight dehydration. Cortisol, the stress hormone, spikes, and your heart works harder to get oxygen to your brain. For adults over 60, these early hours are a perfect storm for stroke. That's why more strokes happen between 6 and 10 a.m. than any other time of day. But here's the key. The habits you follow or skip during this window can either protect your brain or push it over the edge. The good news. You don't need drastic changes. Just smart, consistent actions starting the moment you wake up. The first habit is simple but crucial. Don't jump out of bed the second you wake up. Most people don't realize this, but going from a lying position to standing too quickly can cause a sudden drop in blood pressure, a condition called orthostatic hypotension. For someone over 60, that drop can make you feel dizzy, lightheaded, or even faint. But worse, it can briefly starve your brain of oxygen, triggering a chain reaction that may lead to a stroke. Your body needs time to transition from sleep to full alertness. Overnight, your heart rate slows your blood pools in your lower body, and your brain runs on lower oxygen demand. The moment you wake up, your heart and brain are asked to perform at full power, and if you rise too quickly, they can't keep up. Instead, give yourself just 60 to 90 seconds. When you open your eyes, lie still and take 5 deep breaths. Slowly roll to your side. Sit up with your feet on the floor. Stay there for 30 seconds. Then stand gently. This small habit helps regulate your circulation, protects your balance, and ensures your brain isn't shocked into activity. I've seen it make a major difference in patients who used to suffer morning dizziness or unsteadiness, and in several cases, it helped prevent dangerous falls that could have ended in disaster. It sounds too easy to matter. But after treating thousands of stroke survivors, I can tell you it's these little moments done every day that stack up to real protection. And speaking of small habits with big impact, let's talk about the very next thing you should do after waking up. Drink water. Once you're on your feet, the very next thing your brain and heart need isn't caffeine, it's water. After 6 to 8 hours of sleep, your body is naturally dehydrated. And that dehydration makes your blood thicker, your vessels tighter, and your stroke risk higher. Most people don't realize that blood viscosity, the thickness of your blood, can increase overnight. That means your heart has to work harder to pump oxygen to the brain. For older adults, that extra pressure on the cardiovascular system during the first hour of the day can be dangerous. Dehydrated blood flows slower clots more easily and puts you at greater risk for ischemic stroke. The solution. Start your day with a simple glass of water, about 250 to 300 milliliters, ideally at room temperature or slightly warm. This helps jumpstart your circulation, improves digestion, and rehydrates your cells before you introduce food, coffee, or medications. I've had patients who suffered from frequent morning headaches, lightheadedness, or brain fog, who saw major improvements simply by drinking water first thing in the morning. It's not magic. It's physiology. Your brain is 75% water. When it's dehydrated, it doesn't function well. When it's rehydrated, everything works better. If you want to make this habit even more powerful, add a slice of lemon or a pinch of sea salt to your water to help with electrolyte balance. But honestly, plain filtered water is more than enough. The key is consistency. Make it the first thing you do every morning, before coffee, before breakfast, before checking your phone. Keep a glass of water by your bed if needed. This 1-minute habit could help keep your blood flowing and your brain safe. Next, let's look at how morning movement done gently can make all the difference. After rehydrating your body, the next stroke prevention habit is to move gently within the first hour of waking up. Not a full workout, not high intensity, just light intentional movement to get your blood flowing. Why does this matter? Because in the early morning, your blood is naturally more sluggish, your circulation is slower, and your blood pressure is higher. A gentle walk or stretching session can help normalize your heart rate, improve oxygen delivery to the brain, and reduce the stiffness in your arteries that often leads to clots. In fact, studies have shown that even 10 minutes of low-impact movement in the morning can lower systolic blood pressure by 5 to 10 points for the rest of the day. That's a powerful stroke defense, no pills required. Here's what I recommend. If you're able, take a 10-15-minute walk outside. Fresh air, sunlight, and motion all work together to improve brain and heart function. If walking outside isn't an option, try 5 minutes of stretching or light yoga indoors, focusing on neck, shoulders, spine, and legs. Gentle arm swings, side bends, or slow neck rotations can also help increase blood flow without strain. For patients with balance issues, seated stretching can work too. The key is movement without pressure, no sudden changes in posture, no holding your breath, and definitely no pushing through pain. Think of this as waking up your arteries. You're reminding your body that it's time to circulate, time to breathe, and time to stabilize. Movement isn't just about flexibility, it's about stroke prevention. Now that your body is moving and your blood is flowing, let's talk about what you put into it next. Your breakfast, because what you eat in the morning can either fuel your brain or clog your arteries. Once your body is moving, it's time to fuel it right, and breakfast is one of the most underrated tools in stroke prevention. What you eat in the morning can either support healthy blood vessels or quietly push you toward trouble. Here's the science breakfast sets your blood sugar, blood pressure, and cholesterol tone for the entire day. A high-fat, high-sodium breakfast like bacon sausage or buttered white toast can spike your blood pressure, inflame your arteries, and thicken your blood within hours. But a heart-friendly breakfast does the opposite. It stabilizes your energy, improves brain blood flow, and protects the delicate lining of your blood vessels. So what does a stroke prevention breakfast look like? Here are some practical options. Oatmeal topped with berries and ground flaxseed, rich in soluble fiber and antioxidants. 2 boiled eggs with half an avocado and whole grain toast, packed with healthy fats and protein. Greek yogurt with walnuts and sliced banana supports brain function and electrolyte balance. Smoothie with spinach, chia seeds, almond butter, and frozen berries, easy to digest and full of protective nutrients. These foods are high in fiber, magnesium, potassium, and healthy fats nutrients proven to lower blood pressure and support healthy circulation. They also help reduce inflammation, which is a major contributor to stroke risk. If you drink coffee, drink it after food, not on an empty stomach. It's easier on your blood vessels and nervous system. And if you're not a breakfast eater, start small. Even a handful of almonds and a piece of fruit is better than nothing. Your brain needs clean, stable fuel, especially in the morning. And your first meal of the day is a chance to fight stroke, one bite at a time. Next, let's cover a habit that may sound obvious but is often missed, taking your medications on time. This next habit might seem obvious, but it's one of the most dangerously overlooked. Take your prescribed medications on time every morning. I've seen too many stroke patients end up in the hospital not because their condition worsened, but because they simply skipped a dose. Especially for people managing high blood pressure, diabetes, or atrial fibrillation, missing your morning pills can drastically increase your stroke risk before noon. Why? Because medications like blood pressure drugs, blood thinners, and cholesterol-lowering agents are designed to work in rhythm with your body. Many of them reach peak effectiveness 3 to 6 hours after you take them, which means your morning dose is protecting you right through the window when most strokes occur. Skipping just one day can cause blood pressure to spike, blood sugar to surge, or clotting to increase without you feeling a thing until it's too late. Here's what I recommend. Keep your medications in a clearly labeled pill organizer sorted by day. Set a daily alarm on your phone or smart device as a reminder. Take them with breakfast or right after your morning glass of water to make it a routine. If any medication causes dizziness, nausea, or fatigue, talk to your doctor. Never skip or adjust on your own. For some people, medication is optional, but for others, it's life-saving. And the morning dose is the one that often makes the biggest difference. Think of your pills not as a burden, but as protection, as part of a routine that's actively guarding your brain, your heart, and your independence. Next, let's move beyond the physical and talk about how your mindset in the morning can shape your stroke risk too. Now that we've addressed your body, let's turn to your mind, because how you think and feel each morning can be just as important as what you eat or do. Stress is one of the most overlooked risk factors for stroke. When you start your day in a state of panic, frustration, or tension, your body releases a surge of cortisol and adrenaline. These hormones raise your blood pressure, constrict your blood vessels, and make your blood more likely to clot. It's a perfect recipe for a stroke, especially in older adults with underlying conditions. That's why habit number 6 is this: create a moment of mental calm every morning. You don't need to meditate for 30 minutes or chant mantras. Just give yourself 2 to 5 minutes of quiet before the chaos of the day begins. Here's a simple routine I often recommend to patients. Sit in a chair or stay in bed. Close your eyes. Inhale deeply through your nose for 4 seconds, hold for 4 seconds, then exhale slowly for 6 seconds. Repeat this breathing pattern for 5 to 10 rounds. This activates your parasympathetic nervous system, what we call the rest, and restores state. It lowers your heart rate and blood pressure, naturally helping protect your vascular system before your day even starts. Habit number 7 builds on this calm by introducing one more powerful practice: gratitude. Why gratitude? Because when you consciously focus on something positive, even something small, it rewires your brain away from stress and toward resilience. That mental shift reduces cortisol, improves sleep, and supports long-term heart and brain health. Keep it simple. Each morning before you reach for your phone, write down or mentally name one thing you're grateful for. It could be your spouse, a warm cup of coffee, your grandchild's smile, the ability to breathe, walk, think, and choose. These emotional practices may seem soft, but their impact is measurable. Studies have shown that people who engage in daily gratitude and mindfulness experience lower blood pressure, reduced inflammation, and better stroke recovery outcomes. When you combine mental calm with physical habits, you create a full-circle approach to stroke prevention. Now let's bring it all together with a clear, simple reminder of the habits that protect your brain each morning. So let's recap. Your brain is most vulnerable in the morning, but it's also when you have the most control. Wake up slowly. Drink water. Move your body. Eat wisely. Take your medications. Breathe deeply. And give thanks. These 7 habits don't require a gym, a doctor's office, or a big budget. Just a few quiet minutes every morning to protect the most important thing: you have your brain. I've spent over 30 years helping people recover from stroke, but I'd rather help you prevent one. And these habits, they work if you stick with them. If this video helped you, please give it a like, share it with someone who needs it, and subscribe for more practical doctor-backed guidance on how to protect your health as you age. Thank you for watching, and remember, your best protection starts the moment you wake up.